here at the premises of the Corporate Health Ghana Limited to speak to the CEO of the organization, Abdul Salam Mohammed, who came in second at the maiden edition of the Presidential Business Pitch organized by the Ministry of Business Development as part of efforts by the government to equip the youth and startups and reduce the unemployment rate. We are measuring the success of the program and want to know a year on how he has fared. Abdul Salam, welcome.
Thank you.
So you came in second at the maiden edition of the Presidential Business Pitch. What is your corporate health idea all about?
Basically, if you listen to the pitch, I guess you were there at the maiden event. Our idea and vision seeks to use technology to improve access to quality healthcare in Ghana. Basically, that is our vision. We wanted to make technology a point to transform health sector in Ghana, basically.
At what stage were you in implementing this idea?
Okay, so the idea of corporate health has been in existence from 2015. We've had the idea and then we quickly registered it. But nothing practical was going on because I'm working as a professional and it's difficult, combining that with a lot of activities. And it's also because we didn't have the capital and the needed support to kickstart the business. So by the time we applied for the presidential business pitch, we had an idea, barely the idea, nothing substantial on the ground before we entered.
And so you were not in existence, you were not operating prior to that?
We were not operating.
I know that each winner or the final 10 people were given some amount of money. Did you receive your share of it, and how has it influenced your work in any way?
We received more support even beyond the money, which involves technical support and a lot of consultancy to help you shape your business. Because our business idea, as we pitched, we created a short code and a mobile app with which the general public will be able to make requests for healthcare. So the idea is to make healthcare convenient. In the country currently, if you are to seek healthcare, the processes are very cumbersome and stressful. You don't even know where to go. When with technology, it is quite easy for you to sit in your room, just dial our short code, and then you can request healthcare. So that was the premise of what we wanted to do. Before the presidential pitch, it was merely an idea, a dream. Today, it is a reality.
So just to be sure, how much did you receive?
I received 45,000.
And so you received it immediately after the program?
I think after the program, one good thing that the ministry did is that to make sure we don't waste the money. After the program, they didn't give us the money immediately. They had a consultant that helped us shape the idea, and the consultant helped us develop a business plan before they released the money. So I think barely in 3 weeks after the event, we had all received the money, and we had the opportunity, a very wonderful opportunity to meet the president in his office, and then we had, a conversation with the president. They gave us some very prestigious gifts. So we have 2 technologies.
Okay.
One is meant for the general public. So, i.e. patients, anybody who needs healthcare.
And the name?
And the name of that short code is, we call it Corporate Health Connect short code. And it goes like *711 *90#.
Okay, so it's
a short code. It's a short
code. So it's not an app for the general public.
The general public uses the short code. What they need is the short code, so that it is easy for you to make the request. Because if you need an app, you're going to download and it takes time. So in terms of our model, we decided to make the general public use the short code to make the request. So if you are to download, to just make a dial, *711.
So welcome to Corporate Health Ghana, Accra only. Home care, medical screening, school health, hospital appointments. What are the options?
So we have 9 options there.
Okay.
The first option is home care.
Yes.
The second one is medical screening. We have school health. We have hospital appointments.
So let's say school health. So I choose 3.
Choose 3.
School health. Then what's next?
So it asks you about the category, the classification, either
JHS, primary, tertiary, so 4. Tertiary.
4.
Then select screening
So
type.
the type of screening you want.
Oh, okay. So this is, say, a school that wants screening.
Yes.
So if you want an appointment with a doctor too, you go through the same process.
Yes. So for each of the service, it has its own.
So if
request.
I wanted a doctor to come see me, I go through the same process.
So that is probably
location.
hospital appointment. You want
Yes.
to connect to a specialist. What hospital appointment basically means is you need to see a specialist.
Okay.
So if you go to the hospital, you go and join the queue and all of that. What this does is we book appointment for you at a specific hospital with a specific, and we give you
when you need the service from now.
You get it?
Okay. Pay for facilitation and request fee.
Yes.
Okay, so because I've requested and all of those.
That's
so
that service.
Where does the money go to? It comes to you.
It comes to corporate health. That's our.
Okay, and then you send me to. I choose the hospital I want to go to.
So what this happens is. So this is how the technology happens. The short code is meant for the general public.
Okay.
So you make a request, we receive your request.
Okay.
And it shows on our dashboard. If you are to pick the dashboard, you see the dashboard here. So the requests will come on our dashboard. We look at the request. Where there is the need for us to further call you and take in more details, we'll do that.
Okay.
And from there, we push it to the mobile app. So the mobile app, that is where we have the professionals, we have the facilities there.
Okay.
So it's like we are connecting through the dashboard. It comes from the general public. We process it, we push it to the mobile app. And immediately on the other end, there are service providers and professionals who are ready to serve you.
So they'll come to your home?
So, yes, so they select for each of the service and its pathway. Some of the service we come to wherever you are. For some, it cannot be done at your home, like diagnostic appointment.
Okay.
We cannot pick the entire logistics, but
yes.
what we do is we make your experience, customer experience, better by booking the appointment and telling you that exactly at this time you can get to the facility.
So how then do you make enough funds? Because this is 10 CD, 5 CD, 5 CD for the appointment. So how do you make enough funds to pay the doctors? Do you pay them, the doctors?
No. It's
voluntary.
It's not voluntary. It's business. What we're doing is business. So once we give a doctor a patient, the doctor will charge you for his professional service. What you are paying through our short code is basically the facilitation, the request fee.
Oh, okay.
Nothing more than that. That's why averagely our cost is just 5 cedis. It's just 5 cedis averagely. Just the processing request.
And then when the doctor goes, you pay the doctor. You also have a share in that.
No, we don't.
You don't.
The doctors take their money directly. We don't have anything to do with the money that you give to the doctor or the facility. What we do is
there are doctors, professionals, and hospitals.
Yes.
With the app, I make the request here, and then what you do is kind of to act as a median, as the middle person to meet the professional. Your target market is for people in the corporate world and working class, should I say.
That was our target group, but when we started, we realized that even the middle class, the lower class are interested. We've seen requests and from people that because of that, we had to re-stratify our pricing, our target options and all of that, because it looks like everybody is interested. Everybody wants the convenience of healthcare.
What kind of support have you gotten from the ministry since the program? So after they helped you structure your business plan, they gave you the money, have they taken you through any training as they claim they have during the Meet the Press? Have you received any supervision? Are they monitoring your business? What have they done for you since?
This presidential business page and other programs that are happening, for me personally, is one of the best initiatives we have in this country. Because for people like us, we've had our visions and our dreams. Until we had this support, we couldn't have had and easily translate what we wanted to do into reality. Before the presidential pitch, what I had was a vision, an idea. Today it's a reality. We have developed 3 technologies together, and this is just in less than a year, or let's say averagely a year. We've developed a short code, we have a mobile app, and we have a dashboard. And all of these are well synchronized, they are working. And as we speak now, we've had professionals joining. We have almost about 70 professionals that have shown interest in being on the app. We've actually approved 35 because for each professional we had to do a little background check, talk to regulators and see about your qualifications, to see that you have your license and all of that. That is really amazing. And like you asked, beyond the money, I personally have had so much contact with NEIP office, which works directly from the office of the Ministry of Business. And they've supported us, even in developing corporate systems, your marketing systems, your governance systems, your operation system, to that bit. The officers at NEIP are always ready. You can walk to them with or without appointment, go and sit there and tell them, this is my challenge, and then they will give you idea. I remember one time I was having a serious challenge in terms of the business. I didn't really know where to go. I just walked to Mr. Ayin. I think he's one of the operations manager at NEIP, and then he sat me down, gave me the strategies and all of that. So I think it's been a great experience, seriously. And if I had my way, I would say the presidential pitch should be organized twice in a year, so that a lot more youth will have that opportunity beyond getting the funding.
What has the funding come to do for you?
The creation of the technology is a huge cost. So we use the funding to do that. We've also used the funding to brand. So before, our branding was different. Today, we've branded very well. If you go to our website, you see a very good, well branding. We've been able to use the funding also to acquire a vehicle. The reason why we've been able to do all of this is because beyond the presidential pitch, had some further support also from NEIP. Then the Presidential Business Support Program had a support also from there. So we've been able to acquire a vehicle because a lot of our operations require going down. When a patient make request, you need to send your medical assessment team to go and meet the patient and do assessment and really understand what is the need of the patient before you can now post it for other professionals to accept it as job. And we've been able to also acquire some significant medical logistics that we need for the purpose of our work. And we've been able to equip the office in terms of computers and other things that we need for our business.
How many people do you have now, a year down the line? If you say you've actually received support, what structures have you put in place? And if you can get us or give us concrete numbers,
Great.
facts behind the numbers in terms of people who have ordered before and now, so that we can measure.
Before presidential pitch, we didn't have any technology. So the technology development and the current systems we have, these are all things that came after the presidential pitch because of the funding. And in terms of the structure of our work, our protocols, our operations, our marketing, we didn't have any marketing team. Today, we've been able to have a contract. We have contracted 3 people to do marketing and administrative staff for us. We've also been able to contract 3 medical professionals to handle our medical assessment. And we've been able to fully employ 1 as our operations manager.
So that brings the total number of staff, both contract and permanent, to about 9?
7. 7. That is excluding me.
Okay.
And this is also excluding the technology team, which now we've had to strike a deal with the technology providers, and they are also more or less like a corporate partners. And so from the technology team, we have a group of 3 technology developers, like programmers and coders, who are working with us full time. So anytime we need anything technology, these 3 people are there too, because they are now more or less like a corporate shareholder of corporate.
So a year down the line, approximately you have 10 staff you are working with.
Yeah.
On your this thing.
And you came to meet 4 of them from Burkina Institute of Technology. These are interns.
Oh, yes.
These are interns. This is all the way from Burkina. And how did they come here? We made an application to ACES, to St. Stewart Institute, Germany. They were excited to realize that our application that they are processing, they were giving us some advice, 1 second place at the presidential pitch. So they actually came to observe, to really look at what we have done. And they said, okay, that's good. We have a partnering institution, Burkina Institute of Technology in Burkina Faso. We will send you some personnel to come and intern here, learn about what we're doing, at the same time see how they can also help your business, because these are all tech people. They are all great, the public, because it's a demand and supply business.
Okay.
So you need to make sure that your suppliers, your partners, the professionals, and the facilities, you have enough of them in your system before you open it up to the general public. Even though the system is fully working, but we're not on the general public yet. On the side of the professionals, I've mentioned that we have about 70 registration. We have approved 35. The reason for that is that we're still going through the application, because healthcare is a serious thing. So you want to be sure that you will approve somebody who is qualified, who has the needed background, the needed experience, and he has the license and all of that before we approve. So we approved 35. And the process we use is we request you to give us a referee, and you also give us your license and all of that, which we cross-check with the regulators and make sure that you are somebody who is in good standing as a professional before we approve you. Because once you're on the mobile app, automatically you can have access to health-related jobs, and then you can do.
So you are doing more of personal selling to specific corporate entities to buy into your idea. How many of such corporate entities do you have?
So for now we have about six
of
facilities.
Okay.
I can mention for sure Sunshine Healthcare Institute. We have a center. We have G2. G2 is almost on board. Then we have Best Scan, also in Kolebu. So these are the facilities, health service.
Yes, they are on board.
Yes.
But I mean companies or people who have, so far you haven't had anyone apply to receive healthcare.
That's what I'm saying. For now, we've not started advertising, because the general public will not know. We're still setting up. We're still setting up.
And all of this is with support from the ministry, or?
Exactly, absolutely. We had no funding from anywhere. I think what is most important that I've seen from the ministry is for your business to succeed first. Because if my business doesn't succeed, how do I pay back?
Okay.
The funding and the scheme is meant to strengthen you as an entrepreneur. What they are doing is the monitoring. So they've requested that occasionally you send them your reports. Occasionally they will send someone. They have designated a contact person for all the presidential pitch beneficiaries. So if you have anything, you need anything to the ministry, you have to just email or call the person and then give the person the feedback. The current number we have in our dashboard is enough for us to start serving the public. So your interview is just timely.
The support is coming from the ministry, like you have said. But do you face, have you faced any challenge? What are the greatest challenges you would say is hindering or has delayed your business?
When we started the process, we realized that it was overwhelming than what we thought. I think we can just go through the dashboard and the mobile app and you see it was really a complete development of technology, software we've done. So we didn't underestimate that it would take us that long to set up technologically. So that has been the number one challenge, because it's hugely a health technology business. And to get the right people, the technology developers, at a point they became so much in love with the idea that they said they want to be part of it. You see, so because it was overwhelming, you need to get somebody who believes that this vision will succeed to be with you all this up to now. So that is the number one challenge. The other challenge of it is that, forming a team. This is not something one person can do. The vision can come from one person, but when you want to make it a reality, you need to be able to really put together a team that will do the work. So that process of forming the team is also quite challenging, coupled with the fact that you have other things that you have to do and all of that. And for the type of target group we have, you needed to establish systems before you start. It's part of the reasons why we intentionally made sure that we get it right before we go out. Because this is technology, the issue of data, security, and all of that, you need to make sure. We need to also make sure we get in contact with all the regulators to officially inform them about what we want to do and take their advice and all of that.
Which you have done now.
We've done that. We've written to all the
Ghana Health Service, Ministry of Health,
Medical and Dental Council, NMC, all of them, we've written to them officially. We've had meetings with the regulators. They've also told us their processes. Some of them, they gazette the list of professional license individuals under their authorities. Okay. Some of them, they've shown us the processes if we want to verify any health professional, what we have to do and all of that. So we've done all of this, and this is all part of the setup. We've been able to now have an advisory board, because that's one of the things we advise from the ministry and NEIP. You need to have an advisory team that can be looking into what you're doing. Other than that, by the time you realize you are off the way, so we have that. We've been able to now establish operational modalities, because this is huge business, right from when somebody needs your request, picks the phone to make a request, to somebody sitting behind the dashboard to talk to the person, to somebody pushing it to the mobile app, to the professional making a request, to somebody going on the ground. It's a huge chain of work, and you need to establish a system before you can start this.
How many clients are you looking at serving monthly and yearly? Because you are charging an average of 5 CD, and I'm looking at over time. So as you are starting, what's your projection?
Yes, so our projection is that if we are able to do a minimum of 50 per each of the requests in a month. So we have 9 requests. So we have 9 different type of services. Okay. If you do 50 by 9, that's almost 450. If we are to do 450 every month, that's huge. But our revenue stream comes from both ends. So the general public makes the request, and the professionals, as they subscribe onto the mobile app, they also have an annual subscription that they put.
Okay. Is there some kind of networking amongst you startups? Do you have any idea as to whether you are the only one receiving this support, or people who are under different streams are receiving the same attention from the ministry? Is it because you fell under the presidential pitch you are getting this, or you know of other businesses that are receiving similar supports from the ministry?
You see, it is not just the beneficiaries of the business, the presidential business pitch across all the streams of the program being implemented, and have some working relationship across all these programs, because beyond the presidential pitch, I'm also a beneficiary of the presidential business support program, which falls directly under NEIP. I'm a beneficiary there, and then I've also provided training for the mainstream program that they do. So, and one thing they've done that makes it so easy for them to achieve all the results they've mentioned is because they've decided to work with hubs, incubator hubs all over the nation. So it is easy for them to amplify whatever they want to do, because if they had 7,000 people to train, the ministry or NEIP doesn't train them directly. They have other hubs all over, and we have also done training here, because beyond this we also have Zongo Business Incubator here that we do the training. Okay. So they post all of this.
So how many people have come through the Zongo Business Incubator?
For the training, yes. For the training, the first year we trained 104. This year we've trained 75.
Wow, so that's roughly about 200 people.
You get it. So multiply this by the number of hubs we have, and they are working with. And that's huge. It's a huge training, and the hubs have that responsibility to stay in contact with all the beneficiaries. So we have WhatsApp pages where you keep on supporting them, you keep on advising them, you keep on, so it's an ecosystem that they have created that is making this magic. The ecosystem is strong.
So to end the interview, just a brief, I would want us to delve into how the app actually works. We've seen how the mobile application works.
The short code.
The short code works. Now the mobile application, the name is 120/80 app. Yeah. And so how does it work? So how does the doctor
basically 120/80 app is the name of the platform that health professionals and facilities download. So you go to Play Store, you type 120/80, and 120/80 is like the normal BP. So every health professional really knows that number, and it's easy to actually remember.
Yes.
So once you download, what you do is you go down to register. So you can go through the process as we see. So select your category. either an individual. So you can select an individual, select a nurse, for example.
Okay.
Then it takes you to the next stage.
Okay.
And this stage takes your referee. So we use the details of the referee to actually do a cross-check. So after the referee, if you can just put in something, then we go to the next step. Yes, so basically, you go through the process to subscribe. You cannot enter until we approve of you and give you the login details. So once you have the login details, you now can log in. And then this is the dashboard that comes. This is our interface. So quickly, jobs available. So we have listing of about 9 jobs. Home care, for example. So if we have jobs on home care, it will have been posted under home care. Medical screening jobs will be a hospital appointment, and in all of that you can easily, so for example, if we had a diagnostic appointment, the job will be here, and the professional or the facility interested, we just click apply. It goes to our dashboard.
So if you have 2 or 3 people applying, the first to apply has it?
No. We normally have a turnaround time. Once we receive the applications, we use a lot of things. Capacity, closer, and then sometimes your charges.
I've been having a discussion with the CEO of the Corporate Health Ghana Limited, who came up second at the maiden edition of the Presidential Business Pitch. One of the initiatives that the government, through the Ministry of Business Development, has introduced to help startups stand on their feet and give them monitoring and support to ensure that they blossom into big corporate entities. He has told us the kind of support that the ministry has offered to him and how that has impacted the business from its inception at the idea stage until now, when they have a full office where they operate from.